Hi, everyone. Welcome to Mama Wears Athleisure. I am your host, Mariela de Santiago, a first-time mom. We focus on all things mom with tips to help make life easier and more organized for all you mamas out there. Hi, everyone. Today, I'm here with Cristina Zheng, and we're going to talk a little bit about diastasis recti.
Hi, Mariela. Thank you so much for having me here. So my name is Dr. Cristina Zheng, and I am a mom of one awesome toddler. And I am a doctor of physical therapy. I specialize in pelvic floor physical therapy in women of all ages and stages of motherhood and womanhood. I started holistic healing physical therapy with a vision to provide women with a higher level of care that they deserve. This has allowed me to provide more value and meaningful care through one-on-one treatments without having the red tape from insurance companies.
You mentioned that you provide one-on-one, and I just kind of want to get an idea. Do you happen to offer anything online for anyone that isn't local to the San Diego area?
So I do telehealth physical therapy as well. That is also one-on-one because it's with me and it's going to be like a 60-minute treatment. So we do exercises, troubleshoot, different issues they may be having with different exercises. So it's just like a in-person one-on-one treatment, but it's just virtual.
So we're going to go ahead and just jump straight into it. So what is diastasis recti? I myself have seen it and heard it be said very often now that I am kind of in the world of birth workers.
Yeah.
And as a parent. So what is this?
In order to understand that, I think I need to talk about what the linea alba is. So the linea alba, it's that white connective tissue that is actually between your abdominal muscles that runs down the midline of your abdomen. The tissue functions to maintain the proper positioning of the abdominal muscles. So when there is prolonged intra-abdominal pressure, so a lot of pressure pushing against that belly wall, such as during pregnancy, when the baby grows, that linea alba actually widens, it stretches out, and it causes that separation of the abdominal muscles. And it leaves that space down the midline of the abdomen. So that is called diastasis recti, also known as abdominal separation, mom pooch, mommy tummy, fupa. So it doesn't only affect women, it also affects men and women that have never had babies. The reason being, it's usually because of improper intra-abdominal pressure management, such as when they're lifting weights or even a high BMI can affect that.
Well, you kind of already answered my next question, which was how this affected pregnant women.
Pregnancy naturally and necessarily puts a lot of pressure on the front of the belly, right? So when the baby grows, it's going to stretch out. And in fact, 100% of women will have some degree of diastasis recti by 35 weeks of pregnancy. So having diastasis recti during pregnancy is common and not necessarily dangerous. The degree and the width of the DR, I'm going to call it DR, depends on several factors, such as the mom's core and pelvic floor strength and integrity prior to and during pregnancy. Their pressure management habits. Are they holding their breath and bearing down a lot when they lift? Are they straining to have bowel movements? Because that straining is that breath holding and pushing out of the belly to push the stool up. How they manage the pressure during daily activities and exercise is another factor that contributes to this. Having more than one child, especially if you have children that are closer in age, having a previous C-section birth is another risk factor. As you can imagine, the muscles are being cut through, as well as the linea alba. So there is already a little bit of not a defect, but it's already been compromised. So having a previous C-section birth can contribute to your subsequent pregnancies and your risk of having DR. Older maternal age and having a heavy baby, twins, triplets, or more. So for mamas with DR, it typically does resolve itself within the first few months of postpartum. For some women, it does not. Roughly 30 to 33% of women will actually continue to have DR 1 year after postpartum.
How would this then affect those individuals that do have it postpartum?
Let me go back to how it affects them during pregnancy. So during pregnancy, when you have a DR, it can disrupt the transfer of pressure through your abdominal canister, let's call it. And that would cause low back pain, hip pain, pelvic floor pain, pubic bone pain, sciatica, poor posture, and it can even potentially affect your vaginal delivery. It can make it longer and more difficult. How it affects postpartum women, it's pretty similar in that you have pelvic floor weakness, leaking, low back pain, pelvic pain, again, the poor posture, poor and ineffective breathing, and of course that mommy pooch or that mom pooch that just doesn't seem to go away no matter what you do.
Is it possible for this to be avoided during your pregnancy to
Yeah,
help avoid
yeah,
it during your postpartum stage?
right. So like I said, like 100% of women during pregnancy will have some degree of that DR. But what I tell women is that what you do during your pregnancy will significantly impact how well you recover after childbirth. So implementing the right and safe core exercises into your prenatal fitness routine will actually help you recover better after birth. So instead of being part of that statistic of 33% of women still have DR after 12 months, you can significantly decrease your healing time by doing the right things during your pregnancy.
Well, and that kind of leads me to my next question, which is probably where your services would step in. What can be done to help treat DR if women have it postpartum or that year after they've already
Mhm.
had their baby?
If you suspect that you have DR, typically women suspect they have DR because they have that mom pooch. They feel generally weak around the core area. Maybe they have low back pain. So if you suspect that you have DR, I would highly recommend that you be seen by a pelvic floor physical therapist or a women's health physical therapist to help you diagnose that condition prior to getting treatment, whether it's treatment by yourself, doing your own things, or in physical therapy. So in order to treat it properly and effectively, figuring out all the contributing factors would be the next step so that you can tackle each one to get more of an effective and long-lasting result. While you can try to work on it yourself, working with a pelvic floor physical therapist can not only get you healed faster, but they can also help address any associated pains or dysfunctions you may have related to your pregnancy, because many of these other pains and dysfunctions are actually associated with DR.
Oh, wow. Never thought of that. Well, I just would have never really thought that, a pelvic floor. Actually, let me backtrack. I never knew what a pelvic floor therapist was until I had a baby. So now that I have a baby and I have learned all of these amazing supports that a pelvic floor physical therapist can provide, it's pretty crazy that we don't know or alert women.
Right.
So, yes, really, somebody can come and be seen after they have it, if they suspect that they have it. But the best thing to do, it sounds like, would be to be seen by a pelvic floor physical therapist during your pregnancy to help you so that after you have the baby, your chances of having this are much lower.
Correct. Yeah, I'm glad you mentioned that. And I completely agree with you. I feel like most women do not know what pelvic floor is or pelvic floor physical therapy is. There's just not enough awareness and education out there. Having physical therapy during pregnancy should just be the standard of care, in my opinion, because there's so much involved in pregnancy, as you know. Having a pelvic floor physical therapist do an assessment and giving you the proper exercises to do during your prenatal period can help you so much for health for the baby and health for yourself. Pelvic floor physical therapy during pregnancy can address that core weakness and help you get you in a better position, not only for that DR, but also to help you have a better labor and delivery, a more comfortable pregnancy too.
Do you have any other tips, suggestions, or recommendations on really anything that is related to diastasis recti or pelvic floor physical therapy suggestions?
Since we're talking about DR, some of the suggestions, well, one thing that I want people to keep in mind is that you can have DR, and usually you have probably other problems that basically led to DR. So other problems would be like the core and pelvic floor weakness. So you're going to need some strengthening work. breath work is a huge one. Usually I start people immediately with assessing their breath, how they're breathing, how they're managing that pressure, how they're lifting and breathing at the same time, because the breath is actually kind of the foundation of how well your core and pelvic floor will function. So I like to address the breath work for optimal pressure management, decreasing tightness of the pelvic floor and within the diaphragm, re-educating women on the proper posture and lifting mechanics. So those are all tips that I would suggest someone look into if they're looking to get help for this, because they will all contribute to the healing of DR. So some problems associated with DR actually is things like leaking, urine leaking, pain with sex, prolapse, and we talked about low back pain, pelvic girdle pain. All of these are things that I want to basically plant a seed into women's head that if you're having these problems along with your DR, then you really should be seen so that all of them can be addressed, because you can actually address all of them at the same time as when you're getting treatment for your DR. So some tips that I would recommend is that do not strain when you're lifting. You know, as new moms, we're constantly having to bend over to lift our babies, right? So when we lift our babies, sometimes we're holding our breath. And as our babies grow older, we're probably holding our breaths more to brace for the weight of the baby. So you're going down, you're holding your breath, and you're picking the baby up. And what is that doing when you're holding your breath? You're actually holding your breath and you're extending your abdomen out. So that's going to exacerbate that DR. Holding your breath or straining during bowel movements, that's another one. So improving your bowel and bladder habits will significantly help with the symptoms and also decrease your likelihood of straining. Get treated for your constipation so you don't strain. As far as returning to exercise is great, but there are certain exercises you might want to avoid initially, just because if you do not have the proper mechanics or breathing mechanics for it, then you're going to make things worse. So avoiding certain daily activities and exercise really isn't the solution. It will only cause more dysfunction in your body elsewhere and later on. That is why I stress that getting treatment is the best idea. And if physical therapy fails to heal your DR, then there's always surgery.
Thank you. I appreciate you taking time for us and chatting about this and giving us information on really what we can do to help ensure that we can treat this or our chances of having it postpartum are minimized. So, yeah, thank you so much.
You're so welcome. And thank you so much for having me on here. Like I said, I just want to bring this awareness to as many women as possible.
Yes, so necessary.
So glad you have this podcast, because this is empowerment for us. So thank you for doing this.
Thank you for listening. Tune in next week for our next episode. You can find us on Instagram for more updates and tips. Be sure to subscribe wherever you listen to your podcasts and give us a review if you like us.